Triple board certified, you say? So this is cosmetic surgeon's wife, and you've probably seen her on TikTok. She's gone viral recently for having pretty extensive facial surgery done by her husband, which is an ethical issue in itself. But in particular, a lot of the commentary has been around the fact that he stapled her face in an area, an incision line that we don't typically staple, and the incision was not done in a way that we typically do. And I checked him out, and because I was confused, this is not something you typically see in my community, and he is not in fact a plastic surgeon. And so I asked her why her husband's comfortable doing plastic surgery on people when he's not properly trained, and this was her response. And it's a great example of how people like her husband mislead the general public. So as a patient, you deserve someone who's properly trained in the area that you're seeing them for. And so the only ACGME residency that trains in cosmetic procedures for the face and body is plastic surgery. Facial plastic surgery fellowship for facial surgery only, and oculoplastic fellowship for plastic surgery of the orbit. Now, most states have truth in advertising laws, and so you're actually not allowed to say things like this in many states, my state, California included, because what he is certified in are not legitimate boards. So he apparently has a DO board certification in general surgery and cosmetic surgery, as well as facial cosmetic surgery. Those two boards are not considered legitimate in my state, and they are not ACGME approved training programs. And this comment again demonstrates why you need to ask the right questions as a patient. You can't just ask, are you board certified? It's important to ask, what are you board certified in, and then verify it yourself. So for most physicians, if you go to certificationmatters.org, you can put your physician's name in and it will tell you what board certifications they hold. So me, if you put me in there, you'll see general surgery and plastic surgery. If you put him in, you see nothing. And he is a DO, so his board certification is in the DO realm, which there are some DOs that don't go through the certification process with the MDs, and that is a legitimate board, but cosmetic surgery and facial cosmetic are not. The last thing she says is about hospital privileges, and this is also why you can't just say, do you have privileges? You have to ask, do you have privileges to do the procedure you're doing on me at the surgery center? And we all can get privileges at legitimate hospitals in the areas in which we're trained and board certified. That is not the case in areas that you do not have approved accredited training, or board certification. So it's important, again, hospital privileges alone is not important. An ER doctor has hospital privileges. That doesn't mean they should be doing liposuction on you, right? And that's the same situation here. People that care about you do the proper training because they want to do the best for you. Stay safe, vet your doctors, ask them more questions, and don't accept answers like this.